Let's move things along and welcome Julie Quenneville onto the program. She's president and CEO of the MUHC. Hi, Julie. How you doing?
Good. Thanks for the invitation.
It's great to have you on. Of course, we've got some really great news. The MUHC merging with the Montreal Chest Institute. They've launched a new campaign. They hope the Institute will remain a world leader in respiratory care. So tell us the details here. Tell us about this quote-unquote merger.
Well, it's really an important moment, an important milestone in our history. So our objective with this merger is to preserve the incredible history of the Montreal Chest Institute. It is such a little-known, incredible institution in Montreal. We plan to reduce the costs, which means more money for care, more money for patients, more money for research. And, of course, we're joining forces now to raise $10 million to support clinical care and research at the Montreal Chest Institute of the MUHC.
And I just want to be clear, these are the foundations that are merging, right?
Exactly. The hospitals actually all merged back in 1998. It was a great moment where the McGill hospital community got together to create the McGill University Health Centre. So at the time it was the Montreal General Hospital, the Royal Victoria Hospital, the Montreal Chest Institute, and the Montreal Children's Hospital. And as you know, Elias, we moved in, most of these hospitals, the Children's, the Chest, and the Royal Vic moved into the Glen site, so our brand new hospital in 2015.
And I guess behind this is I guess there's some synergy to be had there, but also when it comes to foundations and operating those foundations, you think this will be good for raising the funds that the Montreal Chest Institute needs?
Absolutely. So what we're planning to do with this great campaign is we're focusing on a couple of areas, Elias. So the first one, and my favorite, are innovation awards. What people don't know is that researchers actually have to prove that their research works before they can even apply for a research grant. So through these innovation awards, with a scientific advisory committee, we will select the top projects. We will put in some seed funding. Every dollar we put in through philanthropy allows us to get up to $4 from different grants across the country and globally as well. And another exciting project, if anyone has ever had a chronic care disease, leaving the hospital, being discharged is a terrifying moment. So we are going to implement a home monitoring process of our chronic care patients so that we can monitor their vital signs at a distance and we can rapidly intervene when it's necessary. And the third area, Elias, that we really want to focus on is clinical research. And we saw this in the pandemic, right? I mean, at the MUHC, we were able to provide our patients with COVID-19 access to 100% of the medications that are on the market and believed to work for COVID-19. The only reason we can do that is because we have a clinical trial platform, and when we create one, it allows us to go and get the clinical trials from all around the world, which means our patients, our community, they have access to the best medication years before the government agrees to fund them. So this is an important move for our community.
And just speaking of COVID-19, we know that COVID-19 has an impact on the lungs, right? So I'm sure the Montreal Chest Institute is at the center of research into that. Can you tell us a little bit more on what they're doing when it comes to the impact of COVID-19 and the long-term impact that it has on lungs?
You're absolutely right. You know, the last few months we've been really focused on curing and better diagnosis of COVID-19. The next step, as we're coming to an end to this pandemic, we all hope, is to look at the long-term damage to the immune system and to the lungs. So we have research teams that have been working on biobanking, have been working on sequencing the COVID-19, and now we're working together at developing research projects to look at this long-term damage. And we're in a unique position, Elias, because we have all of these researchers from different areas of care. The challenge we've had with COVID-19 is it's not only about the lungs, it also impacts other organs. And so everyone is working together in order to study this virus and look at the long-term damage and how do we correct some of those, including neurological damage, which is going to be very important in our research.
With Julie Quenneville from the MUHC Foundation. So Julie, the Montreal Chest Institute, the research into respiratory illnesses, I'm thinking about asthma right off the top of my head. But the work, and as you begin this $10 million fundraising campaign for the Montreal Chest Institute, we're talking about a lot of diseases that affect a lot of our listeners. What other things are we talking about?
Absolutely. And I just want to go back to the history that most Montrealers don't know. You know, the Montreal Chest Institute was actually originally named the Royal Edward Institute. And when it opened in 1909, it was King Edward who flipped on the lights at the inauguration through a transatlantic telegraph from England to Montreal.
Wow.
And for the monarchists who are listening to us today, it's a pretty great story. And it was initially created to deal with the tuberculosis epidemic. And the first iron lung was actually created at the Montreal Chest Institute. We have a few examples in storage at our Art and Heritage Center. And so we're hoping to put those on exhibit in the coming months when people can come and visit us at the hospital. But these medical heroes at the Montreal Chest Institute literally wrote the book on respiratory medicine. They developed the new treatment strategies for tuberculosis that are now standard of care globally. And even today, Elias, the Montreal Chest Institute has one of the best outcomes in the world for cystic fibrosis. So we're extremely proud to have this medical jewel as part of the MUHC.
Julie, success on the new $10 million fundraising campaign, and I want to thank you for coming on.
Thanks for the invitation.
Julie Quenneville is president and CEO of the MUHC Foundation.